it's really important to consider the overall symptom management from start to finish, meaning that when patients first present with their cancer, they've got symptoms obviously relating to the tumour itself, such as pain, but also effects of the tumour such as failure of the pancreas, so things like digestive failure. And so firstly, the important thing is to look at the symptoms as a whole and manage the symptoms aggressively right from the beginning. Because if you have a patient whose symptoms are well controlled, then they will tolerate the treatment obviously much better than if they're already struggling. So for instance, at first presentation, aggressive management of pain, correction of any constipation, because the pancreas is intimately related anatomically to the nerves that work the bowel, and if the nerves are affected, then obviously the bowel can play up, and some people that manifests as diarrhea and some people as constipation. So I think early aggressive treatment of those symptoms, and also recognition that many patients with pancreatic cancer at diagnosis are already malnourished and have had significant weight loss, sometimes 10% of their body weight or more. And it's important to recognise this, so that can be corrected by giving pancreatic enzyme supplements, because the better the nutritional status, then the better the energy of the patient, the better the energy, the weller they are, the more they're able to do, and it keeps them well while they're on treatment. And it's obviously the treatment that's making the big difference in terms of, prolonging lives. So in terms of the drug toxicities, we use several recipes of treatment for pancreatic cancer, and each of the recipes has its own footprint of side effects. But also some of the drugs that we use as companions to the chemotherapy to prevent nausea have their own set of side effects as well. So I think it's worth breaking down side effects related to the drugs, that are actually the chemotherapy drugs that we use to treat the cancer, and side effects of the supportive care drugs that we give along with the chemotherapy. The commonly experienced side effects of the main chemotherapy recipe we use, called gemcitabine and nab-paclitaxel, are effects on the bone marrow, which are mainly caused by the gemcitabine, and effects on the nervous system, which is caused by the nab-paclitaxel. Now, the nab-paclitaxel is from the leaf of the South Pacific yew tree, and used to be dissolved in a very unpleasant solvent that used to make nerve tissue behave really badly. But the modern version of this drug, which is the nab-paclitaxel, eliminates the solvent, dissolves in water, and so side effects tend to be less and more short-lived. So for instance, the neuropathy, which is numbness and tingling, sometimes a burning sensation, but often people will just describe initially slight loss of sensation in the fingertips, which then gradually spreads up the hands, same with the toes. So for the average patient who's just started treatment for pancreatic cancer, they'll be on gemcitabine and nab-paclitaxel, otherwise known as Gemzara-Abraxane. And if they start to get blood side effects, low hemoglobin, low white cell count, low platelets, this is virtually always a side effect of the gemcitabine. And so it's important for us that we maintain the dose of the companion drug, in this case nab-paclitaxel, and reduce just the drug that's causing the actual toxicity. Because in days gone by, if a person experienced a side effect, the initial reflex, the gut reaction is just to reduce the dose of everything. And of course, if you're not getting toxicity from this drug, then you really want to keep this drug at the best level to get the best optimum outcome for the patient.